Hello, it's Dr. Tyler Hamel, Kingwood Chiropractor, and today I'm going to talk about plantar fasciitis. So, do you ever have the issue of when you get out of bed and you go to step down on your foot that you feel intense pain on the bottom of your foot? Well, there's a lot more people that are dealing with plantar fasciitis today. So it could be anybody from a flight attendant to somebody wearing high heels. It could be a runner or a tennis player. There's lots of extra stress. So a lot of people don't know the kind of the cause of plantar fasciitis or really what it is. So we have a patient here. We're going to explain kind of what you can do. And I've had plantar fasciitis myself, and I've figured out a way to help get rid of it or help treat it naturally. So if we look at this patient's calf here, to explain plantar fasciitis, we always look on the bottom of the foot, and it's usually near the heel. Like when somebody gets out of bed and they're talking about really bad pain when they go to step down, it's usually right in the medial part of the heel there. So everybody has a plantar fascia, which if my hand is the fascia, it kind of lays like this on the bottom of the foot. But a plantar fasciitis means that the fascia is inflamed, right? That's why it gives you that kind of pain. So oftentimes what people do is they look at just the area of pain itself, and they don't look like where it might be coming from. All right, so plantar fasciitis, we look at the things that play a part. So the calf muscle here, and think of it as the calf muscle, it comes down here and it turns into the Achilles tendon, that wraps around the heel, and that turns into the plantar fascia. So if we have calf tightness here, it's going to go down to the Achilles and the plantar fascia. So to get rid of plantar fasciitis, that is one of the keys. So when patients come in with plantar fasciitis, how do we treat them? That's one of the main things we do, is try to release the calf muscle, try to stretch it out, and also release some of the joints in the ankle and in the toes in the foot itself. So what we're going to do is just demonstrate a treatment of plantar fasciitis here on this patient. So what I'm going to do is use this little massager first. It's a massager that has vibration and massage. We're going to try to really loosen up the calf and get a little bit of blood flow in there. Okay, so that's the first part of the treatment. Usually we'll do that for about 3 minutes, and then from this point on we're going to stretch the calf muscle out. So the calf is a very big muscle. Actually, part of it will cross the knee joint and the other part comes down here. So there's a lot of muscle to be tight, and as a result it affects the Achilles tendon and also the plantar fascia. So now we're going to stretch it a little bit. I'm going to lean in this way and just stretch the calf, and we're going to do it on a couple different planes. So I'll push first straight down, then I'm going to rotate her foot a little bit to the inside, go back to neutral, then a little bit to the outside. And I'm just going to keep doing that for a couple minutes here. Just have her keep breathing nice and easy. So lots of people with plantar fasciitis, they will tell me just how tight the calf muscle is when we're stretching it. So that makes a lot of sense, because if you have plantar fasciitis, most likely you're going to have really tight calves, and until you get rid of that, there's no way that the stress from the plantar fascia is going to be released at all. So this is a key thing. Even when I'm putting my hand flat on the bottom of the foot here, they'll feel some of the stretching in the foot itself or in the plantar fascia itself. This is kind of a bonus. We really want to stretch the hip or the calf, but we'll also stretch the bottom of the foot at the same time. So I'm going to do this for a couple minutes, just kind of back and forth. So I'm never removing the stretch, I'm just stretching it on a couple different planes. Okay, good. Then if you can flip on over to your back for me. Okay, then if we come down here, now we're going to look at, there's a few different joints that are in the foot itself, right? There's the joints in the ankle, there's the joints in the toes. So lots of times with plantar fasciitis, we're going to have some issues with some of these toes in here. Oftentimes, you'll see that, well, men and women, but especially women's shoes, that the toes will kind of be extended up a little bit this way. So we're just kind of going to go just over to a couple different ones here and try to flex them a little bit more. All right, so the more extended the toes are, the more stress it's going to put on the plantar fascia, so we want to try to balance that out. Sometimes we hear little pops and cracks here, and it can be oh, there we go. It can be a little bit sore to do that. There we go. Okay. And we're going to come down here to the ankle as well. Just try to get a little bit more movement in the ankle joint. When the calf is tight, when the Achilles is tight, you'll notice that your ankle range of motion is not going to be as good as it should be. Good. Very good. All right, let me grab one more thing here. So then we're all said and done with that. We're going to make sure to give the patient some stretches that they can do at home to help out with the calf, right? So this is a treatment which is going to take a lot of pressure off the plantar fascia, but we want to make sure that the patient has something to take home with them. So this is a stretching board here, but you can use a stair or something, or a rolled up towel. And you're going to put your foot on like this, and you're going to lean towards the wall. So keep the heel down and try to push that same knee into the wall. And you can do it pushing laterally, you can go straight ahead, you can push medially. Whenever you're stretching the calf, you want to stretch it at least 30 seconds. Okay, something else you can do that's actually for the plantar fascia itself is you can get a tennis ball or a baseball, and you can take off your shoe, and basically what you're going to do is put the ball on the floor here, and you're just going to roll up and down with your foot, just back and forth, back and forth. So that'll try to release some of the plantar fascia itself, which again, it's not the main thing causing it, but it never hurts to try to release some of the plantar fascia as well. The main thing is going to be in the calf. We have to release the calf. We have to get the ankle and the toes moving a little bit better. And that's basically when plantar fasciitis patients come in, that is a routine that will take them through at least a couple visits to get them some relief. So if you're dealing with plantar fasciitis, if it isn't going away, if you've tried medicine, so medicine, shots, surgeries, that really doesn't take care of anything. You really have to look at the calf and get that taken care of to get rid of plantar fasciitis. And Dr. Tyler Hamel, your Kingwood Chiropractor. If you're struggling with plantar fascia or fasciitis and you need some help, give us a call, 281-360-8387. Thank you.